that is the rebar that reinforces the body. So it's amazing what it does. It's absolutely imperative that we support this process in our body. Amino acids are very important. I think we all know that is true. Most of us are not deficient in getting amino acids in general, but getting the right combination, getting enough of the ones that what I call bioactive, in other words, or bioavailable, that they haven't been compromised. The result here, as we look at the combination, what Laminine is, we have something called OPT9, which is actually what they call their proprietary combination here of these amino acids that come from the egg, from the marine protein, and also from the phytonutrients, but high in glutamic acid, benefiting and enhancing cognitive function of the brain. It's rich in branched chain amino acids, and that does a great deal to actually counter insomnia. Okay, high in lysine, this is an amino acid, to enhance the release of natural serotonin that's affecting mood and happiness. And rich in arginine, okay, promoting nitric oxide and the production of natural HGH. Okay, and so the thing I want you to really take away from this piece here is that we're providing these nutrients so the body can utilize them in the proper way. And so when someone says to me, well, what's it going to do for me? My typical response is, I don't know, because I don't know exactly what your body needs, but your body does, and it's going to prioritize these things in the way that it needs it the most. The high levels of the amino acid glycine is a natural neurotransmitter, and hydroxyproline that's added through the marine protein make it a potent brain food as well. Amino acids contributed from the yellow pea are added to give the formulation the essential, the full scope of the 22 amino acids that can conform to the ideal protein balance recommended by the World Health Organization. So that's kind of our overview of the amino acid part of our product. But let's focus in now for a moment on the fibroblast growth factor. Now, this may be a new term or a new phrase to you. Fibroblastic growth factor we have referred to as the intelligence or the architect. But Laminine supplies critical fibroblast growth factor, which supports stem cells by assisting in differentiated of undifferentiated cells. In other words, that's the architect part that I talked about in terms of directing it. The earliest research on fibroblast growth factor dates back to the 1980s. FGF is present within the white of an incubated fertilized hen egg, nearing its peak on that 9th to 11th day. And that's where this very special time frame kind of comes into play. Fibroblasts are essential cells which build the extracellular matrix of the body and stimulate the natural production of collagen. Okay, the structural framework of our bodies. Collagen also lines the working surfaces of our articular joints. Okay, collagen is very important, and there's a correlation here with cortisol. As we look at cortisol, it actually has the ability to damage collagen. So when you see somebody who's been under stress, and we're going to talk about cortisol in a moment, you'll see that you might have someone who's been under extraordinary stress and you haven't seen them for a while, and you see them and it's like all of a sudden they look 10 or 20 years older, because that cortisol breaks down collagen and it allows the skin to sag. And so there's a connection, there's a correlation with all these things. Okay. Recent research has shown that low levels of fibroblast growth factor are associated with excessive anxiety and anxiety attacks. That's very interesting. Fibroblast growth factor is critical to the support of the human embryonic stem cell. FGF, as we call it, that's our little short acronym for it, is a critical component of wound healing, of tissue regeneration, and the repair process. So fibroblast growth factor concentrates itself at the site of tissue or organ damage and helps and assists in the repair process. So you think about heart attacks or strokes. Fibroblast growth factor could play a very important role in that as well. FGF also plays a critical role in angiogenesis, or the development of new blood vessels, which is important in bodybuilding and healing of injuries to tissues and to organs. So very important there. So let's shift our focus here for a moment to cortisol and serotonin and some of the other elements here that Laminine seems to have a dramatic effect on and has been shown in clinical trial to actually have an effect on as well. Cortisol is the fight or flight hormone produced by the adrenal glands atop the kidneys in response to stress or perceived extreme danger. Okay, cortisol has been, or Laminine has been clinically proven to reduce cortisol levels by up to 38%. Okay, so that's a pretty dynamic number. And if you look at the study that was done, in fact, we even refer to cortisol as the death hormone because it has such an amazing role that it plays on our health. The data would suggest here that YTE or Laminine shows an enormous effect and benefit psychologically and physiologically. And that's very important because if we get that cortisol elevated and we are not able to modulate that or bring that back down, it can cause major havoc on the body. In fact, there was a book written by Dr. Robert Elliott about stress, and it says, "Is it worth dying for?" It's really not worth dying for. This cortisol plays a major role in terms of, we talked about the fight or flight response, and so forth. But it also causes a lot of damage. Let's talk about some of the dangers of cortisol and why we might want to, be thoughtful about how we can mitigate these prolonged spikes in our cortisol levels. It can have an effect on arrhythmias. Levels of cortisol are twice as high in the morning than at midnight. And that's why when you hear about people having heart attacks and so forth, they often have in the morning because that cortisol level is usually about twice as high first thing in the morning. It is one of the things that helps us get up and get going. But if it gets too far off the chart for too long, it causes some major problems. So physiologic changes. Cortisol is released in response to that stress experience, the fight or flight. That prolonged cortisol secretion, which may be due to chronic stress, can result in some serious physiological changes. So let's talk about insulin resistance, which is a very big topic out there today. But cortisol counteracts insulin. It contributes to hyperglycemia, that's a high blood sugar, causing the liver to produce glucose. But cortisol also inhibits the utilization of glucose. That's what we call insulin resistance. This may be one of the primary contributing factors for the metabolic syndrome. Collagen, we talked a little bit about that, but cortisol induces collagen loss in the skin at a rate of 10 times greater than any other tissue. So collagen loss in the skin contributes to premature wrinkling and sagging of skin. Sodium, which is kind of interesting here, that cortisol inhibits sodium loss through the small intestine. Okay, and this increase in sodium levels may contribute to high blood pressure. So you start to see how this web, when one part moves, all these other areas are affected. Potassium, elevated cortisol causes intense potassium excretion by the body. This may result in elevated blood pressure and heart rhythm abnormalities as well. The immune system. Cortisol can weaken the activity of the immune system, even bone metabolism. Cortisol reduces bone formation, favoring long-term development of osteoporosis. So cortisol also reduces calcium absorption in the intestine. And see, what's important about this, and so as we start to talk about all these different things that are related to cortisol, we have to say, well, how can we effectively modulate or manage the cortisol level? And that's how this comes back to our product, and that's really the correlation that I want to make. Memory. This is an interesting one, especially for the baby boomers. Long-term exposure to cortisol damages the cells in the hippocampus. This damage results in impaired learning. So furthermore, it's been shown that cortisol inhibits memory retrieval of already stored information. And so we all want our brains working the best that we possibly can, so we need to keep these things in consideration. Fertility is another one. It's very interesting about the day that we live in today. It's a pretty fast-paced, sometimes chaotic and stressful life. And we have double-income families and everybody trying to do the best they can with the current economy. But think about this. Cortisol shuts down the reproductive system, resulting in an increased chance of miscarriage and in some cases temporary infertility. And we have had some great stories of some people being able to get pregnant after getting their cortisol managed in the right way. So we definitely want to encourage that in a holistic or in a natural way. So let's move over to serotonin. Serotonin is another big one for the world today, because we correlate serotonin to mood, being happy and having that smile on our face. And we know that the depression market, as it were, is a pretty significant market, which would suggest to us that there are some bigger issues going on here. Serotonin is a neurotransmitter. It's derived from tryptophan, and it regulates mood. Serotonin is certainly associated with feelings of well-being and happiness. We know that. The extract in Laminine is clinically proven to naturally increase serotonin levels. There are other things out there that can increase serotonin. I think that we have to recognize that eating good food and exercising and can all contribute. So it's not that those things can't make an impact, but we need a little bit more, in my opinion, in terms of what we need to really bring our body into balance. Everyone, I think, recognizes that chocolate often brings a smile to people's face. In fact, chocolate can even increase serotonin levels itself, especially dark chocolate. But you'd have to eat pounds and pounds and pounds of dark chocolate in order to have any kind of therapeutic increase, and you may do other damage while you're trying to eat enough chocolate to increase the serotonin level. But the most widely used, of course, are pharmaceutical treatments for depression, are aimed at increasing serotonin, especially SSRIs. And these are selective serotonin reuptake inhibitors. That's the drug. And not all depressed patients respond to these agents or other pharmaceuticals. In fact, an estimated 29 to 46% of patients with major depressive disorders do not respond to any type of treatment or any type of drug treatment. So there needs to be another way that we can help work with this. The SSRI market, interestingly enough, is an $18 billion per year market, providing prescription drugs which don't increase the production of serotonin levels, but only slow its uptake within the nerve synapses, thereby causing mood improvement and alleviation of depression in about half of patients. So it's a strategy of slowing down the uptake so that the amount of serotonin that is produced can be extended in terms of its ability to kind of see someone through a given day. There's a growing interest, of course, in complementary and alternative medicine for a variety of medical conditions, including depression. And depression is one of those areas that has been studied with the effects of the powdered fertilized avian extract. The studies indicate that the fertilized egg powder has an antidepressive effect and may be an alternative or adjunct to antidepressive medication for some patients. But further research, of course, is always necessary, but those indicators have been shown in clinical trial. We're going to move over to testosterone, because this is another one that, in fact, we're seeing more and more commercials on TV about testosterone, which is another indication of our baby boom population, because when we look at all the different hormones that go down, and testosterone being one of them as we age, cortisol, interestingly enough, is the only one that actually goes up. When we want it to kind of stay at a reasonable level or be able to have that spike and come back down, it tends to go up and stay up. In fact, just to add one little more underscore on cortisol, they did a clinical study in elderly people showing that when cortisol levels are elevated or extremely high for an extended period of time, elderly people are 5 times more likely to die from a stressful event. And so it's not about blunting it to the point that it can't go high, but it goes up, and we have to be able to bring it back down, or the damages that we talked about really start to occur, or occur at a more rapid pace. So Laminine and young tissue extract